Let's talk about PVD versus PAD. First off is PVD. This stands for peripheral venous disease. This is a venous problem or a problem with the vein. So what happens is the arteries are wide, so blood is moving and getting to the extremities. But the problem here is it can't get back up because the veins are narrowed, which leads to pooling of blood in the extremities. Next is PAD or peripheral arterial disease. This is an arterial problem or a problem with the artery. So here the problem is that the arteries are narrowed, and we know arteries bring blood to the body, so blood can't even get to the extremities because of this narrowed artery. Now that we understand our patho, we can fly through these signs and symptoms. Now for pain. Both of these conditions will have pain, but PVD tends to have a dull, achy pain, where in PAD we see something called intermittent claudication. So normally we have lots of blood flow and lots of oxygen going to the extremities. Where in PAD we have an arterial problem, so blood can't even get to the extremities. This causes pain. So intermittent claudication is pain in the calf due to the obstruction of blood flow causing ischemia. Intermittent claudication is induced by exercise and relieved by rest. Now for pulses. They both will have pulses, but in PVD, they may not be palpable due to all that edema. Again, these patients' legs are filled with blood. And in PAD, the pulses will be very weak. This is because there isn't a lot of blood flow getting to the area, leading to weak pulses. Next is edema. There will be edema in PVD because remember, the blood is pooling, but not in PAD because there isn't any blood, so there isn't any edema. Now for temperature. In PVD, the legs will be very warm. Well, why is this? This is because blood is warm and we have an excess amount of blood pooling. And in PAD, the legs will be, well, you guessed it, cold because blood is warm and there isn't any blood present in PAD. Next is color. PVD, the color of the leg will be brown or yellow. We call this stasis dermatitis. The reason for this yellowish color is because in PVD, remember the blood is pooling. As the blood pools in the extremities, the cells break down, leaking iron, giving it that brown, yellow appearance like seen here. Where in PAD, the legs will be pale because no blood equals pale skin. In PAD, the legs will also be hairless, dry, and scaly. This is due to lack of nutrients or lack of oxygen from blood flow. Next is wounds. Now, wounds in PVD will be irregularly shaped, where in PAD, they will be round, regular appearance, kind of like a punched out appearance. Now for gangrene. What is gangrene? Gangrene is tissue death caused by an insufficient amount of blood. So in PVD, will we have gangrene? Definitely not. If gangrene is caused by an insufficient amount of blood, in PVD, we have way too much blood, so they definitely won't have gangrene. How about in PAD? Yes, this is an issue here with a lack of blood, so we will definitely see gangrene. Next is positioning, which the NCLEX loves to ask on. For PVD, we will elevate the veins. Remember, all this blood is pooling, so if we elevate it, we have a higher chance of getting blood back to the heart. So remember the memory trick, elevate the veins. For PAD, we want to dangle these legs. We need to get blood moving to the legs, so we dangle them. So we elevate veins and we dangle arteries. If you like how I laid this out, you will love the complete nursing school bundle. It breaks down the most difficult topics in nursing school into easy to understand language. You can find it on my Etsy shop, Nurse in the Making. Happy studying, future nurses.